We've all seen the headlines. The highly contagious and transmissible Delta variant of COVID-19 is spreading widely, including right here in Kentucky. And that news can definitely create concern, and that's why we wanted to hear directly from our audience. We asked you to vote in our poll asking, how concerned are you about the Delta variant? Well, right now, 44% of you are telling us that you're not concerned at all about the variant. 30% are very concerned. The rest fall in between. The average answer, though, is neutral. Well, that prompted us to reach out to health officials to ask them if there's reason to be concerned. Evening Edition's Christiana Ford went in depth with Kentucky Health Commissioner Dr. Stephen Stack. She takes a closer look at that question and dives into when and where you might want to keep your mask on.
Concern over that Delta variant looming large.
The concerning CDC warning on the Delta variant.
With the Delta variant now moving at a blazing pace in the U.S.
Just as we thought we were seeing the end of coronavirus, a new variant triggering faded fear.
The Delta variant is currently the greatest threat in the U.S. to our attempt to eliminate COVID-19.
CDC data shows the Delta variant is spreading and spreading fast. In the span of just 1 month, cases of the strain have gone from near zero to more than 25% of cases in the U.S. But how worried should we be in Kentucky?
You can look wherever you're going. You can look if you're going on vacation in another state. Look up the county, see the positivity rate, see the vaccination rate. And most places in Kentucky, you're going to be better off here than there. But
Governor Beshear is saying that because in Kentucky, the Delta variant makes up just 1% of total cases. The state's top doctor, Stephen Stack, says be responsible, but there's no need to be fearful. And if anyone, he would know.
Coming from your perspective, in your position of leadership, we don't have to be walking on eggshells. We're pretty much in a confident place right now.
If you get vaccinated, you are largely protected from the worst harms.
Studies are proving the Moderna, Pfizer, and Johnson & Johnson vaccines are all highly effective against the Delta variant.
The day that we find a variant for which the vaccines don't work, then people might need to be more concerned. What we're going to have happen over time is either people will get some degree of immunity from being vaccinated or some degree of immunity from being infected.
But at the same time, Dr. Stack says if you live in an area where vaccination rates are low and COVID cases are high, you may need to have an extra level of concern and a mask.
So what we're already seeing across the country, and we'll see it in Kentucky too, is that in communities that have much lower vaccination rates, those will be the ones that have people get particularly sick, who go into intensive care units, go on ventilators, and ultimately and sadly die from what is now a largely preventable bad outcome.
Preventable because he says most Kentuckians' level of fear is in their own hands.
I can rattle off a lot of numbers here, but that's not how we persuade people. We persuade people with stories about the impact to them and their lives and in their families and in their communities. And I think, unfortunately, there's going to have to be some harm that occurs and that will occur in communities with lower vaccination rates. I hope we can prevent as much of that as possible, but people have to make the choice to choose a different path.
As we sit here today, face to face, without masks, Dr. Stack says he's comfortable.
It's also something I'm entirely comfortable doing because I have confidence in the science and the technology, the vaccines, and the things I'm telling you.
After seeing him nearly every day when COVID was at its height, that may be comforting to you as well.
Right now, it doesn't look like we're heading in that direction, but we know how quickly things can change. What would it take for us to go back to lockdowns and restrictions and that fear that we had before?
I hope we never get back, at least not anytime soon, to times where we have to think about more dramatic measures.
Until we hear otherwise, Christiana Ford, Evening Edition.